Hello, everybody. This is Ty with Botu Pharma USA. EQPOD is really excited to bring on Dr. Carleigh Fedorka. She's with CSU. Her background is really exciting, and I just want to preface this by saying the podcast has been really fortunate to bring on some awesome doctors. And Dr. Carleigh is one of the most cited doctors. Let me get out of the way. I'll have her introduce herself and just explain what her specialty is.
For sure. Thank you for having me on here. So my focus for reproduction is reproductive immunology is the easiest way to explain it, but it definitely is just anything that impacts both the immune system and the reproductive tract. So my graduate studies was really on inflammation after breeding, and then that pivoted in the last 6 or 7 years to how the female body tolerates pregnancy, and then also how it both tolerates pregnancy and responds to infection. Because you have to both be able to tolerate that fetus inside of you that is half dad DNA, but also be able to mount an immune response if you get influenza or COVID or any of these diseases. So that's kind of been the passion project. And although reproductive immunology sounds very broad, I promise it all kind of goes together no matter at what stage of the estrus cycle or pregnancy that the mare is in.
Awesome. And we're going to talk about something that I've heard a lot of people just touch on, and there's so many different opinions and thought process about it. So we're going to talk about placentitis. Can you just explain for our basic, intro, think like 4-H, FFA kids that are listening to this, and then we'll get more in depth with the sciencey stuff. But what is it, and really, how would you diagnose it?
Yeah, so that's actually a really fun question for me to answer because I was that 4-H kid that moved to Lexington, Kentucky right out of undergrad, wanted to be a vet. I had no clue what the horse breeding industry was. I was that 4-H pony club kid that had a pony in her backyard. And I moved to Lexington, Kentucky, and I kind of quickly rose through the ranks of the thoroughbred breeding industry. And then I had a mare abort. It was December of 2010, I think. And, you walk out in that field and you see a dead fetus in the field. And there's been no, at least in the case with this mare, there was no real signs that I was aware of. She never acted sick. She never had an increased temperature. And so that's actually what got me into research was being that small breeder that really didn't have a good understanding of placentitis. And it took my veterinarian at the time to say to me, like, I don't have all the answers to your questions. We have a group at the University of Kentucky that studies this for a living. You should go talk to them. And I always joke that I went into the meeting with Dr. Motz Trodson as a pretty pissed off farm manager, and I somehow exited his office an hour later, enrolled as his graduate student. So placentitis is, in its most simplest form, inflammation of the placenta. But the issue when we define placentitis is that there's a variety of causes. So the most common cause is just bacteria getting in through the cervix. So if you think about the horse and most of our ruminant species as well, their anatomy is not set up for success. Their vulva is right beneath their rectum. So every time a horse poops when they're pregnant, there's a chance that that bacteria in that feces is going to get into her reproductive tract. And that's the most common cause of placentitis is just E. coli and strep zoo getting in through that manner and ending up somehow finding the placenta and causing inflammation there. There's a couple of other types of placentitis. There's a type of placentitis that gets in through the bloodstream. There's also a type of placentitis called nocardiaform placentitis, which we have no clue how it gets there. That's actually part of my research line. But the most common type of placentitis is that ascending placentitis that's just getting in through the vaginal vault, through the cervix, and localizing on that fetus and placenta.
So then, when you're talking about the more common placentitis, what are some of the misinformation or I had Joss Moderset on the last
Yeah.
episode. He called it myth information. What are some myth informations or misinformations about placentitis that you can clear up for our listeners?
Yeah, so I think one of the biggest misconceptions that we have about placentitis is that if your mare gets it, she's going to get it again. Now, in the case of ascending placentitis, that most common cause, a lot of the time, a mare acquires that disease because her cervix is messed up. There's either a tear in the cervix, a hole in the cervix, or some form of myopathy of the cervix. And so, if a mare does have a cervical defect, then yes, she is likely to have that disease occur over and over and over again because that cervix isn't doing its job and bacteria can get through it more easily. But if your mare has a competent cervix, she's no more likely to acquire that disease in the next year. So, Joss, Dr. Moderset, is a good friend of mine, and we joke all the time that we tend to use a lot of our medications that are used to treat these diseases as insurance policies. So I've had mares that aborted due to a placentitis at the age of 7, and then they literally live on antibiotics for basically the rest of their life because, they get them rebred within a month or two, and then they're put right back on antibiotics. So that's not how antibiotics work. And it's definitely not the best use of antibiotics. And we have to realize that, a full physical exam of that mare and figuring out what her predisposing factors are is so much more important than just tossing drugs at her.
Yeah, and I think it just goes to, well, it worked last time.
Mm-hmm.
Of course it's going to work again. And then that, just that repetition
Yeah.
of I almost say sloth, right? Like you're just so lazy, or why upset the cart?
Yeah, and it's funny for me. My husband for the last 20 years has been a broodmare manager of a major commercial thoroughbred breeding farm as well. And it sounds easy for me to sit here on the podcast and say like be better. But I couldn't even convince him to be better half the time because he would counter argue me with, we bought this mare for $2.4 million.
Mhm.
And if it helps me sleep at night to give her SMZs twice a day for the next 100 days, I'm going to. And I would then try to outscience him with, yes, but we're creating resistance and let's not do that. And, even scarier, we did a project in 2020 on another type of placentitis. And we had 350 mares enrolled in the study from farms around the university. And it wasn't that they were being treated with one medication. It was that they were being treated with 6 medications. And then when that quote unquote worked because the foal came out alive, then the next year they were put on those same 6 medications. So you're not even sure which one is actually helping you. And then it's just a slippery slope to how many medications and what all they're doing.
Yeah, and then God forbid you the next year you try 5 medications and something
And
happens
she
to the
aborts.
foal.
Yeah, exactly.
Yeah, I told you it was this concoction of 6 medication.
Yep.
Yeah,
No, and that's the most common thing is it's always this is an insurance policy. And I don't mind that train of thought. I was a farm manager. I get the uncomfortable conversations that you have to have with clients and owners, but I do think that there needs at least to be like some scientific justification for what you are doing.
sure. So let's touch on that. As if you're talking to somebody that's just getting into breeding and they're working with a brood mare for the first time, what are some of the diagnostic methods you could use to identify placentitis in pregnancy, or how can we avoid some of that?
Yeah, for sure. So first and foremost, pretty early in my mind, I study late pregnancy. So I consider 200 days of gestation early. But right around that halfway time point of pregnancy, you really want to be checking your horse every single day, if not every other day. And by checking your horse, I mean watching her walk in, seeing if she's cleaning up her feed, seeing if she's having normal bowel movements, like anything you would do with any horse, right? But when she's pregnant and you're slightly worried about these things like placentitis, you really want to be checking her mammary gland. So one of the earliest symptoms that we have in this disease is what we call premature mammary gland development. So we want to make sure that she's not bagging up too early. And if we see her producing a bag at 200, 240, 270, that's cause for concern. The other thing, because this is an ascending infection, because it's coming in through the vagina and in through the cervix, a lot of the time these mares will have discharge coming back out of their vulva. So lifting up her tail twice a day and checking for that discharge, keeping in mind that a lot of the times it's winter, it's freezing out, and it's stuck in her tail and frozen like a little icicle. So not just looking under the tail, but looking into the tail. And those are kind of what we consider to be like our early detections. Now, there's two different trains of thought based on that. Some people watch for those things to change. And if they do change, they then will do ultrasonography and actually measure the thickness between the placenta and the uterus. And we have a pretty darn good standard to tell you whether or not your mare's placenta is too thick, if it has some inflammation. The other train of thought, which is what my husband did and what I would recommend, is that you start doing at least monthly, if not biweekly scans on those high risk insurance pregnancies at about 240 days. And you just keep this routine monitoring of this mare. And then not only do you kind of figure out what her normal is, but then you have a better time of assessing if her placenta looks abnormal. We are trying to invent biomarkers. We are trying to validate little simple blood tests that you can use to help your mares. We unfortunately do not have any validated at the moment, but that is kind of hopefully the future gold standard of diagnostics, because all of those things that I just described, the premature mammary gland development, the vulvar discharge, even the thickening of the placenta, they don't occur right away. So your disease has already progressed by, days, if not weeks, before you're even noticing those things. So the best thing that we could find, which we are actively working on, is a single snapshot, blood test that says, yep, this mare has placentitis. And we've been working on that. I personally have been working on that since 2012. My advisor, Dr. Mott Strozen, my PI from my PhD, has probably been working on it for 35 or 40 years. And we have some ideas of what we think it will look like, but we still have to collect that data.
Yeah, it's exciting to hear, because there's like, just from your experience, everything's hunky dory.
Yeah.
And then all of a sudden, like, what just happened? And then you're stuck in this like shock of what's going on. So let's just go back to, okay, we've now known that our mare has placentitis.
Yep.
What do we do from here?
Yeah, so that's a really good question, and I will probably get in trouble no matter how I answer it, but I will lean on the theriogenologist that raised me, Dr. Karen Wolfsdorf. She's a board certified theriogenologist. She's a partner at Haggard's. I call her my aunt/mom. She would like to be referred to as big sister. But she really taught me from a purist way of selecting treatment based on the physiological signs that you're seeing. So the hallmark paper that was published by Dr. Scott Bailey, I think in 2010, said that the treatment for placentitis is antibiotics, usually TMS or SMZs, combined with pentoxifylline, which is in that paper described as a vasodilator that's going to help with blood flow, and altrinogest, which is Revlimid, right? And Dr. Wolfsdorf really taught me that, yes, like we need to get these mares on broad spectrum antibiotics immediately, because this disease is detection of a pathogen. But she was a big believer in not running towards altrinogest unless the body told her it was needed. So she was a big believer in palpating the uterus, seeing if it felt really nicely toned, and more importantly, both palpating and ultrasounding the cervix. So was the cervix nice and tight? Was it nice and closed off? Or did we see some inflammation of the cervix? Was the cervix starting to dilate? And if it was, she would add that progestin, because, we all know progesterone is there to keep the uterus quiet and to keep the cervix shut. So in those cases with those mares, she would add a progestin. She loved pentoxifylline, but she always said it wasn't just for the blood flow. It was also an anti-inflammatory or an anti-cytokine. And I think that she's really onto something there with this idea that we need an anti-inflammatory as much, if not more, as an antimicrobial, because again, it is a disease of inflammation. It's not a disease entirely of bacteria. So a lot of people are also reaching for estrogens. There's some pretty good data that suggests that they're very, very good in the treatment of placentitis, and I would never tell somebody not to do that. And then there's also some new data on firocoxib, which is Equiox, and again, working as an anti-inflammatory and being quite functional in helping our mares that are suffering from disease. So again, take the whole body in its entirety. I am not against antibiotics. I do think you need to monitor disease progression. And if your mare is still getting increasing amounts of inflammation and there's more separation between those two tissues, you probably need to switch antibiotics. I think a lot of people just put them on SMZs or TMS and then leave them on for 100 days, which is a bit scary and not the best, use of antibiotics. But yeah, once you've detected it and you've started treatment, that treatment plan does not need to be ironclad. You need to keep checking your mare, keep doing ultrasounds, definitely get involved with a very good repro vet. And that treatment plan might change, week by week or month by month. You might have her on Altrinagest or Regimate for a week and then take her off. You might have her on SMZs for 2 weeks and then switch to doxycycline. So it's not a one size shoe fits all treatment method by any means.
Sure. No, and that's really good advice, because I think a lot of it just, again, we're talking about this. It worked.
Yeah.
Why would I take her off of it? Let's just keep her on it until the foal is here and we're good.
Yeah.
I love that idea of like actually taking care, because if it were our, like for me, I've got an 8-month-old boy that's had 3 ear infections in the last 6 months. So we've got, the ENT, but every time he's had an ear infection, it was a different antibiotic. And we were obviously checking him. I don't want to compare my 8-month-old, but that's just what it is. So I love that advice of let's just stay open to maybe changing our regimen.
Mm-hmm.
So I want to go back and touch on, you talked about, you're trying to develop these biomarkers. From a research perspective, what advancements have we made in our understanding of equine placentitis in recent years, and what areas of research are currently underway to further our knowledge?
Yeah, so we there's a couple of different programs in the US and beyond that have really kind of had this passion for placentitis research. The University of Florida with Margot McPherson is one of them. We definitely at the University of Kentucky were another. And our kind of leaders, Michelle LeBlanc and Dr. Mats Trodsen, have created this kind of amazing, what we call experimental model for the disease. So we actually can inoculate these mares right in their cervix with strep zoo, and we can do different amounts of bacteria to either get a more chronic disease or a more acute disease. And in the last, I would say 6 years, at least our lab at the University of Kentucky just kind of blew the socks off. We got really heavy into what we call transcriptomics. So with how science is maturing and getting better, we can also utilize that science for what we love to study. So we were able to do that experimental model and then look at the entire genome of different tissues. And I'm trying to say this in as little of sciencey of way as possible, but we were able to look at like the proteins within fetal fluids. We were able to look at gene expression within not just the placenta or the endometrium, but also like fetal liver and spleen and maternal lungs and, kind of anything that we could get our hands on, we looked at some omics of. And so our group probably published, I don't know, between 30 and 40 papers amongst us about better understanding the basic physiology behind this disease. And some of those papers, including some that I wrote, are so boring, and I will not even try to make excuses for them, because who cares if this one gene upregulated only in the chorioallantois and then did nothing else? Nobody really cares. But what it did is it really expanded on our like broad understanding of this disease. And then we were able to like use that information to create new hypotheses and new projects. So case in point, one of my lab mates and colleagues, Dr. Hassam El-Sheikh Ali, he did kind of the title paper of every gene that could change. What does it look like? And he found that this cytokine called interleukin 6 was one of the upstream regulators of the entire disease. And I said, wow, I've done a lot of work on IL-6. Let me take that piece and I'll, run with it a little bit further. So we looked at this cytokine, and this cytokine in every piece of literature in the horse for the last 30 years has been referred to as a pro-inflammatory cytokine. It's always involved in inflammation. And we were able to actually show that in the disease of placentitis, it's actually anti-inflammatory. And not only is it anti-inflammatory, but it might actually be an indicator of the fetus still being alive. So we then looked at it in circulation to say, ooh, maybe this is one of the biomarkers. Like maybe this is our smoking gun. And not only did it increase in our experimental model, but we also saw that it increased in the field, out in clinical cases. So that is one that we really need to validate, but it came from something so complex and some crazy, literally, like I consider some of my lab mates actual like evil scientists. They're doing the crazy stuff. And then there's people like me that go, okay, that's crazy. How does it apply to my husband? And so it was kind of nice to all work together as this really awesome group at UK where we were able to do that with each other. And so like that's kind of where we're at. We're using that, we call it sequencing data. We're using that sequencing data. We've already sequenced it, we've already analyzed it, and now we're trying to use it to kind of give us some better ideas of how we tackle this moving forward.
Yeah, I mean, when you're talking about biomarkers, interleukins, I think a couple of your papers you talk about like MMP9 and MMP. There's another one out there.
I think 13 was one of the big ones.
And it's like, yeah, like you said, and I love that, it's real, it's like almost borderline evil scientist thing. But how do we practically use that information? How do we get it out to the layperson's hands to understand it better so that they aren't just shotgunning a concoction of different antibiotics and different drugs that are in the long run going to be hurting the industry? So I absolutely love, I'm a nerd when you talk about like the inflammation cascade. Like that to me is just really interesting.
Yeah, and I agree. I think that Carleigh 15 years ago when I started graduate school, I would have been like, just give it to the vets and go. Like if we save one pregnancy, it's worth it. Give it to the vets and go. And after many years of trying to bridge the gap between research and clinical aspects, you start to realize that it needs to be a bit more concrete. We never want to say that we've proven something with science, but it definitely needs to be validated and have not only like the sensitivity and the specificity and cutoff values, but also just even like the lab software for vets to use it. And that's kind of one of our limiting steps with our inflammatory markers, is that so many of them are being run on like high-end immunoassay complexes that cost $150,000. So the vets can't even use those biomarkers, even if we did validate them. So it's going to have to take a series of steps. We're actually currently working with a massive farm in Germany that's helping us get some samples to get some of that validation done. But then the next step is actually going to have to go to the tech side and find somebody that will help us create, a more affordable single test, maybe even stall side rapid analysis of the biomarkers that we figure out do work. And we don't really want to go to the tech side before we have validated them, because it might be interleukin 6, it might be tumor necrosis factor, it might be interleukin 10. Like we don't know. We have 4 or 5 that are in that bubble. But we need to figure out which one it is, figure out how sensitive it is. And then, like you said, I think then the studies are limitless, because then you can look at, is this a marker of fetal viability? Is this a marker of, this mare is going to abort no matter what I do? So let's not throw $5,000 worth of drugs at her when it's not going to end well anyway. The other thing that would be super cool is this a marker of treatment working? So is this a marker that actually gets better as the bacteria get killed by the antibiotic? And then this marker can tell us when to discontinue that treatment. And that, that's a multi-million dollar, but 20-year project looking forward.
Yeah, so we've talked about drugs for treatment. Is there anything else out there of the natural remedy that can help with it? Maybe changing diets, maybe just like hygiene, if that's a thing, if you can do that,
Yep.
is
Yeah,
that possible?
we've talked about this a lot, and that falls into two things. Like you said, hygiene, not so much to placentitis, but there is some good data right now that tells us like giving our pregnant mares baths every once in a while will lower their risk of Clostridium and, our foals getting diseases. So I would definitely argue that it works both ways for pregnant mares as well. There's quite a bit of good data where we're looking more and more at like biologics as antibacterial. So things like lactoferrin or even like Mycobacterium cell wall fraction. The issue with those is that they have to be tested in the pregnant mare. And so that's always like that delicate, we need to like prove it's not going to kill them before we then do any of like our inoculation studies. The one thing I will reiterate to everybody, and this was not about ascending placentitis, but it was about nocardiaform placentitis, is that firacoxib was quite promising in that study that we did in nocardiaform. And we, at least me personally, as a farm manager, I never would have thought to reach for Equiox. Like we would use aspirin or Banamine or whatever, but firacoxib actually does look quite impactful. So I would lean in on that. And then the other thing too is a lot of people are looking at like antioxidants. So looking at vitamin E, or some of the other things that we can kind of supplement with instead of thinking of as a treatment.
Yeah, I think my my listeners that are of the antibiotics
Mm-hmm.
really want to hear about something else, and I don't know if there's research out there now that people are working on to kind of, I don't know, have some science behind it, but just right now it's just overwhelmingly, let's just inoculate them with antibiotics.
Yeah, exactly. And I think that, again, like I'm pretty antibiotic myself. I think that they're overused. I think that they're misused. In the case of placentitis, if you ultrasound your mare and there is separation between her chorion and her endometrium and she has vaginal discharge, get her on antibiotics immediately. Where I would argue that the biomarkers might help with is maybe she only needs to be on SMZs for 10 days, because that is the length of time we would give that horse for a cellulitis or strangles or, any of these other diseases that could be caused by strep zoo. We would discontinue that antibiotic. And in this case, we tend to just treat and treat and treat and treat. And it's both financially devastating for the owner, but also it's just not appropriate use of antibiotics. So I will never tell somebody not to grab antibiotics if their mare is really struggling. What I struggle with is seeing on social media or even getting phone calls or emails from people that just put their horse on treatment for funsies. And that's where I get a little bit more frustrated. We still have people that are giving 1 week of antibiotics every month of pregnancy. That's incredibly not the correct use of antibiotics. That's not good antibiotic stewardship. And we also have people that, maybe they don't live near a vet. And so they just start treating before the vet even gets out there to check their mare. And so we just have to be a bit more careful in those situations. And that comes with immense privilege to say that, because I only ever bred horses in Lexington, Kentucky, and now I'm at Colorado State University. So if I have, if my horse hiccups, I can call a vet and get them there in 15 minutes. So I do think that people just have to, increase their education and increase their knowledge base so that if they're not that close to a vet, they can have some educated conversations either on the phone or hopefully as they're hauling to the nearest vet hospital.
Sure. So if you were to be able to speak to yourself in that very first time that you had to deal with it, what's something that Carleigh now would tell Carleigh then?
Oh, that's a fun one. That mare was funky. I remember, I literally can like envision seeing her fetus in the field. Um, I would have told Carleigh that sometimes you do everything perfectly and the mare's still going to abort. Because in that situation, that was what happened. Like Dr. Wolfsdorf had scanned her. I guess that kind of does lead to another thing is while we tend to focus on ascending placentitis, we ultrasound for ascending placentitis transrectally. So the inflammation is right in front of that cervix. But with nocardiaform placentitis, you will not see the lesion there. You actually have to ultrasound them transabdominally. So I learned in that case that we were so hyper focused on ascending placentitis that we hadn't scanned her transabdominally. And I always do wish now that I know more, that if your mare is bagging up early and her transrectal ultrasound looks normal, slap a probe on her belly, because the site of inflammation or the site of infection might not be where you thought it was. And that's definitely what happened with that mare. But that mare was on treatment. She was in the most, boutique premier farm in the world. She was having her bag and her tail checked twice a day, every day, and she still lost her pregnancy. So again, that's where I think the biomarkers might really, really come in handy, because you could maybe see, just this is again hypothesizing totally, but maybe IL-6 tells you that the fetus is viable. And maybe in that mare, we would have taken that sample and seen that the fetus was already dead or half dead. And that she was one that was a bit not worth saving the pregnancy of. It actually would have been better for her to induce abortion and, rock on for the next season. But yeah, so like a couple of those little things, like just because her transrectal ultrasound looks good doesn't mean she is good. And then also you can do everything right and still feel like the worst broodmare manager in the entire world.
Yeah, it's never fun to see that. And being as young as you were probably thinking, like, is this what this life is going to be like?
Well, it's even funnier now. My husband and I own geldings. I do not own mares. And the number of people that ask us if we're going to breed our own horses, and he and I both are like, ignorance is bliss. Breeding horses is crazy. It doesn't end well ever, because, we just saw the high risk cases constantly. And so now we're both like, oh, maybe it would be better if we had never foaled a mare, and then maybe we would want to actually breed a mare.
Sure. So if you had the attention of the whole world for 90 seconds and you were to talk directly into this crowd about placentitis, what would you say?
Me personally, two things. One, we need to support research. I know that sounds incredibly arrogant and egotistical to say, because I am a researcher, but we do not have a ton of funding for equine research. And yet at the same time, when a $2.4 million mare aborts, it kind of gets blamed on us for not making the headways that the industry hoped would be made. So if you're passionate about a disease or a disorder, realize that there's very little grant money for equine research, and we rely on industry support a ton. So if you're passionate about placentitis like I was, either go to grad school or write a check. The other thing with that being said, though, is that we do seem to find ourselves in this kind of anti-science rhetoric in this day and age. And it can get a bit frustrating as the person trying to do good research and then be able to relay it to the lay person in a, applicable, easy to understand way. Vets aren't out there to get you. Scientists are not out there to get you. There's definitely good vets and bad vets. There's good scientists, there's bad scientists. But the average clinic and university is here to support you and to provide you with continuing education. And if you don't feel comfortable getting it near you, reach out to somebody else. That's why Zoom calls are a thing now, but we can only get better for our horses with that continuing education. And I just really hope that people take everybody in veterinary medicine and science up on it.
Yeah, hopefully somebody that's listening or watching this podcast strokes you a fat check so that you can do some really awesome research on it. Are there anything now? We talked about the biomarkers and things like that, but is that where you would take your attention and your passion and spend that money on? Is that kind
Oh
of what?
yeah, for sure. We've already budgeted for it, and to brutal honesty time, it's going to cost between $200,000 and $300,000 to do that study. So plain and simple, it's just ridiculous amounts of money. Um, Even more so though, like there are so many, like you said, like the treatment studies of let's find a treatment that could function as antimicrobial but not be an antibiotic. Those studies fascinate me and I love them, but they're so expensive. We have to kind of keep in mind, at least on the university level, we have to pay per diem for our horses, and that's going to range from 10 to $30 per day per horse. So anytime that you're doing late pregnancy research, you have to pay for probably between 15 and 20 horses just to get to about 270 days pregnant to start your study. So, it sounds like a cop out. We've definitely hustled our butts off at the University of Kentucky to get a lot of those expensive studies done. But anytime I hear like, well, why aren't you researching that? Or why haven't you done that study? I'm like, ugh, guys, it's really expensive. And that I am at a university now that has a really strong animal science program, and I see my fellow researchers get these $1 million grants, and they're all in cows. We don't eat horses and we don't wear horses. So it's hard to justify for the big money of why we should study horses. So we need horse enthusiasts to start supporting that research.
And I think the other part that you haven't touched on too is like, even if you did get the money, you did the research, you peer reviewed it, and it comes back of, Carleigh, you did it wrong. Here's
Yeah.
what I would have done.
Yeah.
Here's what you missed, or
Yeah.
you didn't have enough horses in that
Yeah, and
control.
that's such a good point. It's also something, like, not to pat myself on the back because I need to pat my mentors on the back, but that is also something too. If anybody's interested in going to graduate school or even going to vet school, um, surrounding yourself with like the godfathers is so crucially important for those reasons, because there is a select group of equine researchers around the world that you can trust to do a good study, that you can trust to do the right statistics, or not overinterpret the data. And I got really lucky at the Gluck Equine Research Center. I had no clue what I was even walking into. I just knew I wanted to stay in Lexington, Kentucky, and that was the university that was down the street. And then I really quickly realized that having Mott Stroudson, Barry Ball, and Ed Squires as my PhD committee was like, I literally was surrounded by the godfathers. So like that is so important, because we need the numbers, we need the power, like we need the experimental design, we need the animals. You'd be amazed at how many of these universities do not have big research herds. So it just needs to be supported. And whether it's financial or just emotional and psychological support, I see a lot pretty nasty Facebook comments on some horse studies. And it's like, guys, they did their best. Like, not everybody has $300,000 to do a study. So we need to support each other and support good research.
Into that. No, I really appreciate your time. There's good conversations that are happening, but I think more of it need to happen that are constructive, right?
Mm-hmm.
Not the Facebook trolls, as I call them, that just are there to comment to stir up the pot. But I think what you're doing is great, and I hope we can shed more light onto that and maybe get more funding to help with this particular issue that is in our industry. So, is there anywhere that our listeners can go to reach out to ask questions or stroke you a check? Like, where can they find you?
Yeah, so you can definitely go to Colorado State University's Department of Animal Sciences website, or you can just email me, which my email is Carleigh, it's CARLEIGH .Fedorka, FEDORKA, at colostate.edu. But always here for questions. I love working with breeders. Like I said, I've been there. And even if I get frustrated, my husband will usually tone me down and tell me to be nicer to people because he's been there. But yeah, we're just, always here, always willing to do some extension, some outreach, but more so just continuing that education portion.
Awesome. Well, again, thank you for being on the podcast. And I'm sure, hopefully this isn't the last time we see you on the podcast, because you've got a ton of studies out there that I'm reading through it. I'm like, oh, I got this question about this study, and we'd love to have you on. Like endometritis is a huge one.
Yeah, for sure.
So yeah, we'd love to have you back on the show here in the next, however long the show runs for.
Yeah, thank you so much for having me. And anytime anybody needs immunology advice, I'm always here.
Awesome. Thank you so much, Carleigh.
Thank you.